Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Are you prepared to save a life in an emergency? With 70% of out-of-hospital heart attacks occurring at home, chances are likely you could be called upon to perform CPR or use an automated external defibrillator or AED. But anyone, including bystanders, can be the difference between life and death for someone experiencing cardiac arrest. Can you be that person? Today, we're talking about how you can by learning more about CPR and using an AED with Dr. David Schwartzman, Director of Cardiac Electrophysiology at the WVU Heart and Vascular Institute. Welcome, Dr. Schwartzman, to Live Healthy West Virginia.
Thank you, Mary.
It's good to have you here.
Likewise.
So, when it comes to CPR, I was certified in CPR 30 years ago when I was pregnant, and it was part of my birthing class. And I've never updated my training, and I wouldn't feel confident performing CPR today. Am I alone in that? Are there a lot of people that feel that way?
No, I don't think you're alone. I think even those who were formally trained, who have not had that experience recently, would sort of feel out of sync. So it would be reasonable to update, and if you are trained, to update on a regular basis. Something like an annual brief class wouldn't be a bad idea, just to remind yourself of the technique and receive any updates from the authorities that develop these scientific standards with regard to this.
Okay, so how has CPR changed over the last 30 years? What have I missed?
Well, primarily the integration of the automatic external defibrillator, which is a crucial piece of technology. Not only its development, but its deployment widely.
Yeah, it's around everywhere now.
Public spaces, et cetera. You know, the incidence of what we call cardiac arrest, which we can talk about, is unusual in the general public. And so rendering these devices to homes or cars, et cetera, is, although would be useful, is still cost prohibitive. But in public spaces, is reasonable to have access to these devices. So that's a crucial element because, as we'll discuss, defibrillation or reversal of the electrical problem that underlies cardiac arrest is the most effective way to save a life in this setting. In addition, the entities that do the science underlying CPR have moved in the direction of simplification.
Yeah.
Primarily removing the requirement, at least in adults, for rescue breathing, which is both technically demanding and also the assumption is that bystanders are reticent to get involved because of concerns to their own safety regarding the element of rescue breathing and cardiopulmonary resuscitation. So, although not required and actually still in the guidelines for babies and pregnant women,
yeah, that's
to say
different.
Rescue breathing. CPR guidelines have moved to what we call compression only. So the old notion of resuscitation that we've all seen in the movies with compression and then breathing into the mouth or nose, et cetera, is no longer a requirement. This is really compression only.
It's just hands only.
Correct.
Okay.
That's
less intimidating.
Less intimidating. But the early access to a external defibrillator and an immediate call to 911 remain essential elements of success.
So that's the first thing you do, is call 911.
Well, yes and no. So if you're alone and you feel you have an unresponsive person who you feel needs CPR, and we can dwell on that later on. Certainly for babies, you go through a sequence of CPR and then hit so a several minute sequence of CPR and then hit 911 on speaker and then go back to your CPR.
Okay. Well, that makes sense.
Yeah.
And we are going to have a demonstration later in this podcast. So if you're listening, it's going to be show and tell today. You may want to switch to watching to video of this podcast. Why is it pretty likely that, I had talked about that statistic earlier on about 70% of out of hospital heart attacks happening in the home. Is it pretty likely that, we could be called upon to use CPR?
I wouldn't say pretty likely.
Probably on a loved one, right?
I wouldn't say it would be likely, but let's put it this way. If you were unfortunate enough as to encounter this on a loved one or a friend or even someone you know, coworker, etc., and were not prepared, it would stay with you.
Yeah,
so
I would feel awful.
Yeah. So what would make sense as part of an act of citizenship would be to become familiar with what CPR is and how to use an AED.
And they're not that hard, right?
They're not.
Okay.
Neither is difficult.
Okay. So just tell us very briefly, what is hands-only CPR? And is it as effective as, the regular CPR, the old school CPR?
So let's back up for a second and understand what's happening. So the heart's a pump, right?
Yep.
So it's what I like to describe to my patients is it's a big piece of muscle, not unlike the muscle in your bicep.
Okay.
That contracts. And with regard to the heart, it's like a block of muscle with a cavity carved out of the middle. Blood flows into that cavity, and the muscle squeezes, sends it forward. Now, blood's job is to move around a series of pipes that we call the circulation, blood being grocery delivery truck in one part of the circulation and trash pickup truck in another. And so the heart's job is to move the trucks. In this term, we use cardiac arrest. Some people use the term heart attack, which is not accurate, but in the lay understanding, I think the notion is that the heart as a pump is an electrical pump.
Right.
Not unlike your washing machine, which is another pump that moves fluid around in circles.
We talked about that the last time you were here. Mm-hmm. Yeah.
That electrical system can go haywire in certain circumstances, leading to essentially an elimination of any effective electrical activation of that muscle, which means the muscle stops contracting. And so the blood is just sitting there in the heart and in the series of pipes we call the circulation, not moving. If it can't move, it can't deliver groceries or pick up trash. Mm-hmm. The idea of CPR is, while the heart is not contracting, to substitute a physical stimulus to make it seem like it's contracting. That is to say, push down on the chest so as to compress that block of muscle, to squeeze blood out of the heart.
Okay,
again and again. Essentially, you are substituting physical force from outside the body to replicate what the heart does, not even close to as efficiently, but efficiently enough to potentially save a life.
So you're manually pumping the heart.
That's correct. And because it's a closed system, when you do that, the act of the cavity opening and closing will move the blood, not unlike taking gas out of a gas tank by sucking on a hose. I don't want to betray my wayward youth, but once you create that vacuum, you then the fluid will flow. Same concept. That is what
Okay.
CPR is.
Okay.
Now, the defibrillator, the AED, doesn't do anything to cause the heart to contract. What it does is it reboots the heart's electrical system. And so because the heart's normal electrical system creates so much more efficient pumping than CPR, you want to reboot as quickly as you possibly can.
Okay.
But you don't want to wait around to do nothing, because if nothing is happening, then organs are very sensitive to the lack of grocery delivery and trash pickup.
Yeah.
It's
It's the beginning of the end.
Well, right. So you have a brief window of a variable amount of minutes, but it's not a long time. And the brain is particularly sensitive to this. And so when we look at failures of resuscitation, we often look to the brain in terms of the most sensitive organ to this. So we're talking minutes. So AED is best as quickly as possible, but CPR should not be delayed waiting around for an AED. When, as we'll demonstrate, when the AED is being used, there is a brief pause in CPR to allow the AED to go through its thing, which is a reasonable pause in order to get the benefit of the most important intervention, which would be a return of effective electrical function of the heart.
Okay. So, speaking of a demonstration, I think this would be a good time. We're going to do show and tell.
Sure.
We're going to show you how to do CPR and also how to use an AED, which scares me to death, but I know it's not going to be as hard as I think it is. Okay, so let's go to the demonstration.
Okay.
All right, Dr. Schwartzman. So before we start the adult CPR demonstration, let's talk about what is the difference between hands-only CPR and so-called regular CPR.
So hands-only CPR is simply chest compressions without any attention to respiratory support or breathing support. The genesis of this was perceived reticence among the decision makers as to whether people would be willing to provide respiratory support, commonly called mouth-to-mouth.
Yes.
And if not, they would do nothing, which is less good than doing something. Also, the science suggests that breathing is a little bit, the respiratory support is a bit overrated relative to the CPR. So for untrained people, the recommendation now is hands-only CPR, which means chest compressions without attention to breathing.
Okay.
For trained people, there can be an element of respiratory support, whether that be mouth-to-mouth or with specific devices that are developed that are more efficient and safer to the provider.
But for the average Joe like me.
If you're untrained with CPR, hands-only is the current recommendation.
Okay, good to know.
Be aware that the first thing that one should do is make sure if there's anybody in the vicinity, make sure you tell them to dial 911 if you don't have a cell phone. If you do, dial it yourself and put it on speaker.
Okay, that makes sense.
Yeah. If someone else is there, they can do that and then tell them to try to find a defibrillator. So public spaces, many businesses, I'm sure this building, for example, has defibrillators located prominently, hospitals certainly.
Also known as an AED.
Correct.
Okay.
And it'll be typically in a well-marked box on the wall, typically white, often with a red cross on it. That's where they're located.
All right. Well, let's start with adult CPR. Let's say I've already called 911 and I have it on speaker here for you.
Right.
What's the first thing we do?
So the notion is to compress the chest so as to mimic the heart's normal mechanical function.
Okay.
And so with your weight, not your total body weight, but you want your shoulders directly above the chest, sort of mid-chest.
Okay.
With the heel of one hand, another hand overneath. Some people like to lock their fingers, other Others will put their hand around the wrist, but the notion is stability. And then compressing the chest to a reasonable degree. I mean, there are measurements that you can make, something on the order of 2 to 2.5 inches for an adult, but to a reasonable degree and at a reasonable rate. And that rate, the recommended rate, hovers around 100 to 120 per minute.
That sounds like a lot.
It is. Mm-hmm. So the American Heart Association likes to teach to follow the beat of the song Staying Alive, which is a Bee Gees song from way back when, which
but we know
a quick
it, don't we?
100 beat.
Staying alive.
It's
Staying alive.
Correct.
Okay.
And that's the rate. And then that continues until help arrives. If there's a defibrillator or an AED that can be brought to the scene, then there'll be a pause while the defibrillator patches are put on, which will show, and that defibrillator will direct you accordingly. But unless there's action being taken by that device, the CPR continues until help arrives.
Can you show us again, like how often and how deep?
So again, the table's a bit high.
Right.
As my shoulders should be above in order to create adequate weight. But
staying alive.
Something like that.
Okay.
Does that make sense?
That does make sense.
Yeah.
That does make sense.
Yeah.
Now, what if we're going to attempt CPR not on an adult, not on an infant, but on like a 10 or 12-year-old? What would be, would there be anything different?
Yes and no. So because respiratory compromise is often upstream of a cardiac arrest in a child, that is to say, they get something stuck in their throat, respiratory support is felt to be more essential.
Okay.
Certainly in the setting of drowning, for example.
Yeah.
But even for an unconscious child, respiratory support is felt to be essential. So that's when for a single provider, that's when the back and forth between compression and so-called mouth-to-mouth comes in. And that, there's a specific ratio of compressions to breaths, which comes out at around anywhere between 15 compressions for 2 breaths or 30 compressions for 2 breaths.
What if somebody feels intimidated? I don't think I'm strong enough to do that.
Yeah.
Is something better than nothing?
Yes.
Okay.
And again, as long as you're using your body weight, there's really nothing happening other than using gravity. So if I'm not using my arms here, I'm just bringing my body above the patient and then just pressing down with my body weight. My arms are straight. So it's not a strength issue. It's simply
endurance.
Well, body positioning. Hopefully not endurance. Hopefully support will arrive quickly, so you're not doing this for long periods of time. But if you don't do it, as we discussed in our back and forth, the window is very narrow. Time window is very narrow. So we're talking minutes before the opportunity is gone.
Okay. All right. So that takes care of how to do CPR on an adult. Let's talk about doing CPR on an infant, because that's quite different. So we're going to have to make a little switch here. All right. We've got our baby mannequin here. What do we need to know that's different with doing CPR to an infant, a baby, as opposed to an adult?
Yeah, so the fundamentals are similar. Obviously, the size of the body will matter, and so some common sense is necessary. Again, like children, because airway issues are so common upstream of these arrests, respiratory support is important because of the face size of an infant. As opposed to mouth, you're really placing your mouth across both nose and mouth.
Oh, okay.
So that's one issue. And then the issue comes to compression. Obviously, putting the force into an adult that you would use in an adult into a baby would be way too much.
Yeah.
And so a couple of different options for a baby. One would be to wrap your hands around, and again, this baby would be sitting on your knee or on your leg, and then using your thumbs to compress. Again, the same rate and the same ratio of compressions, so to breaths, yes.
Okay, and
Or-
still like staying alive.
Yes.
Okay.
Or something similar with the heel of your hand,
Yeah.
something along those lines.
And this baby wouldn't be flat on the floor. They would be on my knee or...
Well, they could be flat on the floor, but the way these things can play out, typically you're picking up the child.
Yeah.
If so, then holding the child stable and compressing this way. Essentially, whatever it takes to get the job done. In the old days, we used to recommend just 2 fingers, front like this, but the general wisdom is that the compressions weren't adequate. So here you're buttressing your thumbs with your fingers,
Yes.
and then you're essentially squeezing the chest between your fingers.
Okay.
And here you're essentially doing CPR as an adult or an older child, so you can easily create a lot of forward pressure. So those are the differences.
And the same as with adult CPR,
Mhm.
you keep doing it till help arrives. And
Right.
hopefully that will be soon because you already
Right.
had somebody call 911.
If you're doing CPR in the field and you haven't contacted anyone, you're making the likelihood of success far less. So the first thing to do is to get 911 on the phone. If you're alone, just put it on speaker, throw the phone on the ground. And if someone's there, they do that. And then their next stop is to find a defibrillator if they possibly can.
Okay. Well, that's what we're going to do next. We're talking with Kara Turley. She is a registered nurse at HVI, but she's also a basic life support instructor. So she trains people how to use an AED in an emergency. And let's start first, Kara, with what does AED stand for?
So AED is going to be your automated external defibrillator. We use it to convert people out of lethal arrhythmias.
Okay. Now, I am terrified of using this. I've never been trained on this, but I know it can't be that bad because these are everywhere, right?
Yes, they are in almost all public places. You can see the signs for them as you're kind of walking through stores or malls or airports at the big AED sign with a heart and electrical bolt through it. So the great thing about them is they are your coach inside the box. So they were going to walk you through everything you're doing like I will.
Okay. All right. So how do I know we need, oh boy, is there an AED here? You know, where do you look? Where do you start?
So if you look down the walls, often you'll see them near like restrooms and all kinds of places. We have them in the cafeteria at Ruby and on the first floor in those lobby areas. So they're available all over in the public.
Okay. So I find one. What do I do? Do I have to break glass or something?
So often they are kept right inside those little cabinets. So in a cabinet, just like a fire extinguisher would be, there's nothing that you have to break. You just open it right up and it'll be everything you need right in here.
Okay.
Sometimes they'll include a little extra things with them, like a razor if you have to shave any hair off the chest. But most of the times it's just the defibrillator with the pads.
Okay. So where do we start? All right, we've got it off the wall. Now what?
So you've got it to the patient now. You've taken it all the way. The first step is going to be opening it. There are a lot of different models. This one is the physio control. So the first step is going to be opening it up. This one, when you open it up, it does turn it on.
Okay.
Call for help now.
And it does give you nice, clear instructions.
Remove all clothing
These are the
from
pads,
patient's chest.
so they have little pictures of exactly where to put them. So the yellow one shows a picture right over the chest here.
Okay.
So you'll apply this right to the chest.
Pull red handle to open
And then
bag.
this one is going to be right over on the side of the chest. And you'll see that
Okay.
picture right
Yep.
there. So you'll apply that right over onto the
Peel
side.
one pad
Okay.
off blue plastic.
And it gives nice instructions
Here, I
too.
got that.
To bare skin. Exactly as shown in the picture.
And it'll give you nice little
pad
feedback
firmly.
too. So if they're not fully
Peel
on, you'll
other
kind of
pad
apply them down a
off
little
blue
more.
Plastic. Apply pad to bare skin. Do check pad. Do not touch patient.
Once the pads are on, you're going to want to let it analyze the rhythm.
Heart rhythm.
So it's going to determine if it is in a shockable rhythm. So it's a rhythm that can be defibrillated
Stand by.
out.
Okay, so it told us
Preparing
don't
to
touch
shock.
the patient.
Yep, so you're going to have hands
So
off
once you
the
put your
patient.
pads on,
Everyone clear.
Hands off.
Yep.
Press flashing button.
And then it's going to have an audible sound as well as a lit signal to show you that you can do your defibrillation. And once you defibrillate,
Shock delivered.
it'll tell you that the shock was
Chest
delivered.
compressions and rescue breath.
Once that shock is delivered, you can go right back
it's
to
safe.
CPR.
It's safe to touch. Just,
Yep.
But once that stops stinging, or
So once it stops stinging, so when I push it, everyone clear, a shock's about to be delivered. Once it's pushed, then
Continue care.
we can provide gas chest compressions again.
okay, so you don't quit doing CPR.
No, you will do CPR up until the moment I say clear and hit that red button.
Now, what if you're by yourself?
So
How do we do this?
if you're by
Continue
yourself,
care.
what you'll do is you'll stop CPR to apply the pads.
Right.
And then you can hear it say analyzing rhythm. So you want to have your hands off the chest. And during that time, it's analyzing to see if it's a shockable rhythm. So you don't want to cause any jostling that could cause any confusion for the device. Once it's the shock is ready, that light will be flashing red. You'll hit that red button. It'll provide that shock, and then you can immediately get back to CPR. And it'll give you another prompt when it's about that 2-minute mark to check to see if it's another rhythm that you could shock again.
Okay, so you'll probably be doing CPR for another 2 minutes.
Yep.
And if the patient's okay, it won't tell you to do anything, right?
Yes.
But if the patient is still in an emergency state, it'll tell you, all right, stand back, right?
Yep. It'll analyze
You don't
the
have
rhythm.
to move the pads. You don't have
Nope,
to do anything.
you don't have to change out the pads. These pads will stay on. We'll do that with our in-hospital defibrillators as well. But this one is nice and simple for the general public. Now, if the rhythm is not shockable, it's still going to tell you to continue care. You want to check, so if every 2 minutes, checking for that carotid pulse, see if there's any return of pulse.
Okay. And when I think of this, I'm afraid of shocking myself or shocking someone else. I mean, is that possible?
It's possible to get a little bit of a jolt of some electricity, but as long as everyone's safe and following clear instructions, so typically you're not going to shock yourself with an AED. The pads will be firmly on the patient. When you go to provide that shock, or someone else, if you have a partner doing this with you, the clear message is everyone stand clear, preparing to shock.
Okay.
And you get that kind of countdown, and then it'll provide that shock. There's no electricity to the patient at that point. They're not electrified, so you'll be safe to touch the patient still.
Right, so you don't take the pads off or anything to
Nope.
keep doing CPR.
You'll still just keep doing CPR, and then at that 2-minute mark, you'll analyze the rhythm again, see if it's shockable or if they have a pulse.
And I think, of course, one of the most important things, because the first thing it told us to do was call
Call for help, yes.
Call 911. And if you're by yourself, you should put your phone on
speakerphone, lay it right by the side. And the great thing about that too is they can provide you with instruction.
Well.
While you're following the prompts of the AED, they can tell you different things to look for as help is on the way.
Okay. Well, that makes me feel a little less intimidated.
Yeah.
So it really is pretty simple and straightforward.
Yes.
And the box will tell me exactly what to do.
The box will tell you exactly what to do. We always say in BLS, the first step is turning it on and then follow the prompts.
Okay. So what do you think is the most important thing we need to know about using an AED?
So I think the most important thing would be that it's not scary. So if you need to use it, it's very user-friendly. It's meant for the general public to use, no specialized training. The best thing to let you know is once you turn it on, you've got a coach in the box.
Coach in the box. I like that. That makes me feel better. I might even try this. I hope I don't need to, but yeah. Well, thank you so much, Kara. This was
You're
great.
so welcome.
Good information. We appreciate it.
Yeah. Thank you so much for having me.
That was a really good demonstration.
Thank you.
So I'm thinking, now that I've taken part in that demonstration, do I have to take a CPR class or a class that teaches me how to use an AED, or was this good enough for me?
Well, if if you knew nothing about CPR except what you've seen on The Pit,
I do watch it too.
an unfortunate number of people do.
Yeah.
I would say have at it, because any CPR is better than no CPR.
Right.
If you're unfortunate enough to have never been trained and you're faced with a situation that you think requires it. That said, as we discussed before, best to take a class. The people who teach these classes are experts. And unlike watching a YouTube video or watching me, the ability to practice understanding the nuances of CPR are very worthwhile. And then I would put it on your calendar as an auto update for an annual class. They're common and they're all over the place. They're fun, actually. There's a lot to learn. And as I mentioned before, CPR techniques, know-how, always being updated.
Yeah.
And so yeah, I would highly recommend a certification in basic life support, what we call basic life support.
Where would be what are some good resources where I can find, where all these classes are?
So the American Heart Association puts forth most of the standards, the American Red Cross as well. So if you go to either of those websites, they'll have links to
local classes.
Exactly. And these classes are always going on.
Right.
So this is not hard to do. You just have to commit to doing it.
Okay.
Public entities, churches, various big box stores, et cetera, will do this for their employees.
Yeah.
We at WVU Medicine have regular training, as you might imagine.
So it's out there.
It's out there.
You just have to look.
You simply have to understand the importance of it. I look at it more or less the way I look at voting and active citizenship, and
that's a good way to look at it.
So there you have it. Yeah.
Okay. Now we mentioned earlier that you're the director of electrophysiology at the WVU Heart and Vascular Institute, and I can't not ask you talk about. I mean, this is a big deal that we have the WVU Heart and Vascular Institute here. I mean, we are world leaders on a lot of fronts when it comes to your heart, aren't we?
Yep.
Talk about a little bit about that depth of experience.
Well, with regard, the Heart and Vascular Institute is state of the art. So,
yep.
With regard to cardiopulmonary resuscitation, it's important to acknowledge that we don't do a lot of it, happily. The people who really do this work and are experts are those who are first responders.
Right.
So medics, EMTs, firemen and women, police officers, because this is happening out where people live. And by the time they get to us, specifically me, the water has gone under the bridge, as it were. Mm-hmm. And I see many times, every week, cases in which effective CPR has allowed a patient to survive to my care. So it's important to acknowledge that this is not a, despite the depth and breadth of HVI's knowledge and capability, this is really a public-facing first responder kind of situation.
Sure.
So it's important to acknowledge their expertise and courage, right?
Yeah.
It takes courage.
It does.
So
it does.
It has my enduring respect.
So tell me then, before we go, what's the most important thing you want our viewers and listeners to know about the importance of knowing CPR and how to use an AED?
So take a CPR class. It'll involve use of AED. It's really easy. It's fun. You meet a lot of interesting people. The instructors are very knowledgeable. And participate. So if you see something going on, don't run away. Mm-hmm. Even if you're just the one who calls 911, Your involvement may well change the trajectory of someone's life. So participation is important.
All right. Well, thank you so much for sharing this information and doing a little show and tell for us today. We really appreciate it and hope we can get more people to learn more about CPR and AED. I know I'm going to do it. So thank you.
Go.
That brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on heart care, visit wvumedicine.org/heart. To find the latest episode of Live Healthy West Virginia, follow us on our YouTube channel at youtube.com/WVU Medicine and click on the Live Healthy West Virginia playlist, or search WVU Medicine to follow us on Spotify to find this podcast and all WVU Medicine podcasts. I'm Mary Ravazio Menard, and on behalf of Dr. Schwartzman and everyone at WVU Medicine, thanks for joining us.